Hi everyone, my name is Thomas. I'm one of the MSK clinicians here at Vita Health Group. I'm going to be taking you through each educational PowerPoint discussing everything from what actually is OA to how we manage your condition to help improve your pain and function. The idea behind these is that by the end of them you should have all the tools and all the knowledge to help you self-manage your OA. So this week we're going to be really trying to understand what is OA, okay, and why it affects our body. On the screen are some facts about OA. OA is the most common form of arthritis affecting around 10 million people within the UK. OA most often develops in people in their late 40s to mid 50s, or it can be sometimes slightly later than that. It can also be earlier if an individual has sustained significant trauma to the joint, such as a fracture, a dislocation, or even something like a reconstruction surgery. About 60% of people living with OA are women. This is because of the changes during the menopause that take place. During menopause, we get a reduction of estrogen. Okay, the estrogen is just a hormone which is produced by the body to help maintain bone and joint health. It can affect joints such as hands, knees, hips, and spine, with the knee being the most affected. OA is a degenerative disease that impacts the structures within the joint. These include cartilage deformation and bone remodeling. Before we kind of move on, I'm just going to take a moment to explain what that actually means for you. So the role of the cartilage is to help absorb force going through the joint, and it also helps with the mobility of the joint. It sits just over the top of the bone, in between the bone and the actual joint structure. Okay, the deformation just refers to its reduction in capacity to do its role. Okay, so it means it won't be able to absorb as much force as it used to be able to. Okay, and then the term bone remodeling, this just means a development of bony spurs, which are small bone growths, usually at the point at where the bone meets the joint. Some may experience pain and stiffness at the joint, and I do want to place an emphasis on some people, as some people can have OA with little to no symptoms. OA often develops slowly and worsens over time. Okay, however, just because OA worsens does not always mean your symptoms can worsen at the same rate. It is important to note that pain is never an accurate way to define how severe your OA actually is, and pain is always an individual experience. Okay, so here across below are some of the common signs that people with OA may experience. So you'll have pain, stiffness, tenderness, a grating sensations, that kind of grind sensation that you may feel, a loss of mobility, and then the bony spurs, which I just talked about previously, and then of course swelling across the joint as well. There are several factors that increase your risk of OA. Okay, they're listed below. So we've got aging, gender, obesity, injuries, overuse, genetics, bone deformities, and then certain metabolic diseases such as type 2 diabetes. Okay, I do want to note that although all these risk factors play a part in the development of OA, some joints have different levels of risk factors. And what I mean by that is when we look at the knee is the two main risk factors for the knee would be obesity and injuries. Okay, whereas when we look at the hand, the main risk factors for the hand would be previous history of injuries and then maybe some genetics as well. So there's no cure for OA, but this does not mean that your condition gets any worse in terms of symptom wise. Okay, and there are ways to help manage and relieve your symptoms. Okay, so listed below are the lifestyle measures. This basically just means sleep, some diet changes, and of course some exercise. Medication, so things like using topical anti-inflammatory gels like Voltarol can really help with your symptoms as well. Supportive therapies such as making maybe like a talking class. And then of course we have the exercise side of things as well. We're going to spend quite a lot of time discussing exercises. Okay, so we're going to save that for the next few weeks. So we're going to cover all the topics across the next few weeks, and all the educational slides will be uploaded onto our YouTube channel. I would encourage you to watch them in order, as each week we will refer to the previous weeks and help with some of the explanation around why you should do certain things like exercise, like diet, and prioritizing your sleep. However, you can also just watch the ones that you find helpful as an individual, as this is a very individual process. Okay, so what I mean by that is something that might work for you might not work for another person, and of course you're all experiencing different types of symptoms and pain. Okay, I would encourage you to, if you do have any questions between now and when I next see you, please write them down, bring them to the next class, and we'll try our best to answer any kind of questions or concerns you may have. But in the meantime, please look after yourself, and thank you very much for listening.